are 69 days old in the position that we're in, to be exact. And a lot of you have feel pity for us. They feel that we are the unfortunate ones to be put into this space and time, particularly at the time where the department comes with a lot of bad reputation. You know, all of you would know about the fire in the Bank of Lisbon. All of you would know about life as demand. All of you will talk about medical litigation. Some of you who know much more will talk about the medical, what we call accruals, you know, the budget deficit that we have as a Department of Health. So generally, our department has been characterized by a lot of bad press and bad media coverage. And of course, when I was sworn in on the day of the swearing in, I had to go and deal with the issue in Mamelodi. So generally, the Mamelodi issue, Mathamare saga, summarizes the challenges that the department has been facing. But I think it's important because when we discussed why high level, you know, people say why high level. And today I was spending half of the time trying to think, I think we need to move beyond Twitter, Facebook, and Instagram, and move beyond complaints, move beyond bad reports, and start engaging in a fruitful discussion about health in Gauteng. And I think one of this is a good start to talk about the financing of the health system. In the past 15 years or so, systematically the health system has been underfunded. There was a series of disinvestment that has been happening in the public health sector. Of course, most of you didn't realize because you basically have medical aids, so you have not felt the impact of the disinvestment. But the people on the ground, the workforce of the health department has felt the disinvestment, which led to a number of problems and challenges that deals with issues of shortage of staff, non-replacement of broken equipment or outdated equipment, or sometimes even purchasing equipment that doesn't fit into the system itself, you know, due to other issues relating to tenders. But again, it's important that we talk about this funding model, you know, and of course now we are talking about the NHI Bill, which is coming. So it makes this discussion so opportune that we are going to talk about the funding model for the future of the health system. I've put it here in capital letters that NHI is not a health system. I think we should be clear about it. And NHI is not a health system, but it's a funding model that is going to recapitalize the health system in the country to make sure that we're able to get money and funds, particularly that is sitting in the private sector, which today at least we are going to get a glimpse of what's happening in the private sector. And it's all about recapitalization to meet the challenges that we face. We have made few simple priorities for ourselves as the new administration in Gauteng, the 6th administration. That ours is about almost two things which are interrelated. You know, because when you resolve the other, it resolves the other one, which is the patient experience and the staff morale. Let's take an example on the patient experience. You know, the major complaints that our patients have is about staff attitude. Our nurses are rude, doctors don't speak to us, they just push us around, they just operated on me, they didn't explain anything, you know, and when you look at it deeply and zoom into it, you'll realize that our staff are overworked because of the shortage. Of course, Prof, they will say they are underpaid, and I'm not immune from that complaint because I'm from there. I know that we are underpaid in the public sector, and also we lack basic tools of trade. You know, we don't provide proper scrubs for doctors in theatre. When I went for the budget vote, I asked for scrubs from Barra because I wanted to make a statement about being in the forefront and be part of the workforce. And the scrubs that they gave me, which I know, I thought maybe they will bring the ones that they've kept for samples, from grapes, but they brought the ones that are from theater, and they were embarrassing, to say the least. The issue of the uniform of staff, of the nurses, something that is a known thing, that we have to provide funding and allowances for staff. The department seems to go into amnesia, when it comes to it, and then it has to be reminded by the union that, hey, Pella, you have to pay and give staff allowances. So these are systems that we have to work on. And these are basic things that we don't have to do a lot of research to correct. It's few things that we can do and we can do correctly. So just an insight on what happens in the private sector in terms of the money will give us a better perspective of what needs to happen. So that we can be able, when you talk about the NHI Bill, we talk about the quality of service. I contend, Commissioner, as I welcome you, that access is not a problem in Gauteng. I think our facilities are opened, for anyone. In Gauteng, in the Bara, Charlotte McGregor, Steve Biko, people from Mpumalanga walk in, people from Limpopo walk in, KZN, they walk in, everywhere they walk, even from Zimbabwe, they walk in. So access is not an issue. And I think we have to go beyond. When we talk about NHI, it must not be about access. It must be about how we are going to improve the quality of healthcare in Gauteng. And we are not going to be waiting, to say we're waiting for the bill to be approved, then we start. We are starting now to do that. And if we change these two things, patient experience and staff morale will be able to at least go slightly further. And I think this discussion is going to talk about the role of the private sector. Yes, Dr. Spoonsfield has said that there are a lot of doctors in private. So it means part of what the NHI has to do is to create and level the playing field and make sure that those who are in private also play in the space of public, but only in the interest of improving the quality of healthcare. So the model that we have to perfect, I favor more of contract work, because I know most of you have got, those of colleagues have got private practice, but you can work 6 hours a day in our facilities, and we pay for that. Instead of paying you being full-time, but you give us 6 hours a day. So that's a problem. So we need to try and make sure that we perfect the model of contracting work, but also increasing the hands on deck to make sure that the outcomes get better. Like I've said, let's move beyond complaints. I think the past 2 months have been overwhelming. Twitter is inundated with complaints from our citizens, of course, for right reasons of the quality of care. But maybe the question should be asked to the public. What is the role of society? Other than reporting bad and adverse outcomes, what is the role of the public and society in improving these outcomes? So do we understand how the health system works? Does the society understand how the health system works? And this is one thing that we need to talk about. So when we talk about high-level discussions, I think it's what we say, we are going beyond Twitter, we are going beyond Instagram, we are going beyond Facebook, but we now want to understand and talk health. Because a number of people, when they talk about health, when they engage on health, they talk about complaints. They don't talk about what we're going to address now, about the funding model and how we're going to improve the quality of care. So let's talk about it. We'll engage on the input. One thing that is going to put us on odds, which I'm going to with the society, is that we need to recourse the 32 billion litigation bill that we have. 32 billion based on what? If it's based on what Mediclinic will cost to treat and manage a cerebral palsy patient, then we know that it's not okay. Or net care, we're not single out Mediclinic, net care clinics and all the private groups. If that's what the cost of the bill that we have on litigation is 32 billion, let's recost it. Let them allow us to recost the bill according to what we can cost it in the public sector. I think that the 2 billion will be very good injection for our own facilities. So Steve Biko can be one of our cerebral palsy specialist unit where we treat all the patients of cerebral palsy. We'll have research capacity, we'll have academics, and we'll also have resources in the center. So let's build those excellence, and then the patients that had adverse effect in our system go and come to our public sector, and then we use the money to recapitalize. So this discussion about the costing and how the funding works in the private sector, I'm excited about it because then it is going to expose that the 32 billion that we are said to be owing might not be the case. And it doesn't discount the fact that yes, the adverse events did happen and we are not denying them and we are remain accountable to them. But let's see. And welcome. We are going beyond Twitter and Instagram, beyond complaints. I think it's time that we start to rally and use that space positively. And that's the reason that we are saying this is a high-level discussion. Let's have a high-level discussion in Gauteng outside patient complaints. Thank you, sir.